Hi guys, my name is Sam. I'm an S&C coach, and what I'm going to be looking at today is Chandler's lower cross syndrome, which is a study taking place in the 1970s, looking at basically the injuries occurring around this pelvic area and also according to the lower back and the thigh region of the body. So first off, what you'll notice is the body will start to give pain indication depending on what's going on, and also you can see from a static alignment point of view what we'll be able to be looking at is where the pelvis will basically have a rotation going in and then back out for the leg. And you'll notice it more as you look into a squatting point of view, where you'll see that the hip region will sort of kink downwards and rotate inwards to follow into the leg. What that can cause is a lot of strain in this lower back region of the spine, and what that can also indicate is a weakness in that area of the body. So if we look back, what you'll tend to notice is normally you would have a tightness in that area, you're looking towards the spine, but also a weakness in the abdominals, which then crosses over as you go through the body to the tight hip flexor region and also a weak glute max region as well. And what that can mean is a lot of strain will be built up in the front and the back of the body, and then that can also worsen the weakness in the other areas of the body as well. So what that can be looked at, especially when you look into a squat, the main sort of functions being from knee extension and flexion during the movement, and also that triple extension coming from the ankle, the knee and also the hip. Now if the hip isn't aligned properly, what you'll find is that the knee will have an increased amount of force going through, and also the ankle as well, just to sort of compensate that movement of the body. Now with that can cause again an extreme amount of pain in the lower back, more strain in the quads, making them even tighter than they were before, and also an increasement in the hamstring region and also in the calves as well. Not only does the gastrocnemius muscle in the calf region cross over this joint, but also the bicep femoris in the hamstring region also does so. So both of those muscles will coincide with each other and cross over and affect each other with the tightness going through. Now all of that would stem from majorly this area around the hip, and if we look back, obviously that would stem from weakness and strength, or not necessarily strength in tightness. A tight muscle isn't necessarily stronger, it is just noticeably not having the full range of motion that you would require for a movement, and especially seeing as many movements such as mainly jumping and moving laterally will affect the muscles around the whole of this region. You want them all to be working and coinciding within one another. So what we'll look at mainly is basically how do we correct this. So we have a lot of tightness and weakness through the sort of lower cross area of the body of the pelvis. So what we're going to look at is mainly how that would affect the squat directly, how you can notice things through looking at the body just through like a sort of static alignment point of view, and also then looking into corrective exercise that will amend these issues, but also try and strengthen the athlete and make them even better than they were before to sort of negate this from happening again. So what we're going to have a look at is basically a couple of reps, just so you can have a look at that anterior pelvic tilt, see if it is occurring, and we'll also get a sort of lateral view so we can see that direct analysis to what we've seen earlier in the video. And basically what we're going to be looking out for, mainly with a higher rep set, you will notice that during the end of that set perhaps, or also during the start of a heavy loading set, you will notice that the anterior pelvic tilt will occur or may occur depending on if the athlete has that lower cross syndrome going on or not. So what I'll do is I'll go for a couple of simple reps, only 3 or 4, we'll do exactly the same from a lateral side of view, so then we can compare the two sort of footages, if you will, and then analyse again in more depth, more of like a static alignment, and also look at corrective exercise to continue with that, okay?
Lower cross syndrome would mainly affect people who work at desktops, for example, who are seated for a long period of time. This can affect things like work, especially if you're getting lower back pain in the workplace. It's not exactly comfortable, but also due to incorrect training as well. Commonly in sports such as golf, football, and rugby, the pelvic movement is key to having a decent fitness level, stopping any sort of pain going through the spine. So that's important to keep in check when we're looking at that. Also, looking more towards the alignment things, especially looking at model A in the image here, where you have like an ideal alignment going through the ear, the shoulder, the hip, the knee, and the ankle are all in a decent alignment. Model B would be more looking at kyphosis and lordosis around the spine at the top, whereas C and D, the flat back and sway back, would be referring to the position of the pelvis in relation to the spine. So that's what we're interested in there. When it comes to what we're going to be looking for during these exercises, is first off we're going to look at the tight areas and stretch them out. It allows the antagonist muscles to work at fuller range of motion. And in these weaker areas we're going to strengthen using different bodyweight exercises that can add weight later on in the program. So then you can develop the muscles that are weaker and also activate the tight muscles still, so they're still being worked. So if we have a look through and we can sort of see what we'll be looking at, okay?